Okay, well, go ahead.
Well,
was letting her.
the problem with the abscesses is it's hard to see them. Sometimes when they get tooth abscesses, and for males it's primarily tusk abscesses, but it can also be abscesses of the rear molars, which you cannot get to unless the pig is under anesthesia, because I mean you've got to put your whole hand in there in order to touch a molar. So the things to look for if you suspect, or if your pig goes off food, of course, suspect an abscess, because that's very common. If they have toxic breath, there is a smell to the abscess, the mouth abscess in particular, that is really distinctive, and once you smell it, you will know immediately what it is. We did Stanley last night and went, you need to check his mouth.
And he has some really green molars back there that I'm a bit concerned of. And one day we found a very large tooth laying in the room, and I'm checking every day. I check, really get in the habit. I mean, okay, this is going to sound weird, but women do breast exams, men do scrotum exams, hopefully. Well, you should be doing jaw exams.
Not just jaw. Cheryl has a pig. I'm sure you probably all heard the story about Gershwin, where I stopped at her house just to visit, and he had cluster abscesses all over his face and his shoulders and his neck. It was an abscess lower tusk, and there was so much infection that cluster abscesses were popping up everywhere.
And they weren't real obvious. It was Kelly. Cheryl didn't notice them because
She didn't notice them, but I was scratching his tummy, and I happened to see a cluster right here on his shoulder, and then run right here under the curvature of his jaw. And I deal with so many pot-bellied pigs and are aware of the problem, and have assisted my vet in some removals, that I knew immediately what it was, and I said, we got to get this pig to see Perry because I suspect it's an abscess tusk, and it was, and tusk removal is probably about a 6-hour surgery, and it's incredible. If you guys have ever seen pictures of it,
I forgot to bring the test. I'm sorry. I should
what we have to do is you have to go in from the back, and we have to open the cheek up here and lay it open, and then you have to get to the base of the tusk back here, and you have to dental drill around it without compromising the integrity of the jaw. And you have to pull the whole tusk from this way out the back of the jaw. So it's a very, very involved process. I think you guys have one pig that did have its tusk moved up here, and the jawbone was compromised, and there's been complications as a result of that. So it's a very involved surgery. 90% of the vets
surgery. She just had that small abscess. Still no longer. In a couple of days, it was small. Became a tennis ball, and it was huge. They went in. They thought, oh my gosh, it's a tumor. When they excised it, it is this big. She had pictures of it. It is this big. They cut it open. It is one mass of solid, hard pus. And then there was another one, the same thing, the size of a tennis ball.
But that was not a tusk.
She said it was an abscess. I did not ask her if it was actually an abscess tusk, but
There
just
are abscesses on the inside of the mouth. There are also surface abscesses. One of my pigs has had it twice, and that's exactly what you describe. It's a self-contained ball of pus. And one of my old pigs got one, and my vet didn't feel comfortable with anesthetizing him, so we gave him a local shot. I rolled him in my lap upside down, and she cut his cheek open.
I wouldn't have been there.
And was scooping out stuff that looked like cottage cheese, and it was so toxic you would pass out.
Everybody says the smell is disgusting.
Oh, it's beyond disgusting.
The question, what causes them, anything, it can happen in males and females.
Mostly bacterial.
It's mostly, yeah. And I mean, we've had, like, the one, you have an abscess tusk. My question to you is, or in any abscess, in the facial abscess, is your pig a grinder? Does it grind its teeth? And I'm trying to just see if that makes a difference. George, one of our pigs who just had a mass removed from his mouth, it was benign and it was not an abscess, but he had 18 teeth pulled. And when the vet went in, he noticed one was loose, popped out, next one loose. I mean, he just kept going. He used to grind his teeth so much, people on the other end of the house would go, what's that sound? And I'm glad we pulled the teeth out, because I'm sure they probably would have abscessed, but I'm wondering if that has to do with compromising the jaw, being a grinder, compromising the root of the tooth, being a grinder, and also shoving the food down in there. Could those pigs, are they the ones who are more prone to having abscesses?
And not only that, but a lot of vets will treat an abscess with one antibiotic. And what Perry and I learned is there are a number of antibiotics that you have to use to treat an abscess, because one antibiotic will treat one type of bacteria, but will be particularly resistant to another type. So when my pig had the abscess, we treated with actually at the beginning 3 antibiotics and then reduced it to 2. Because when we did a culture, we found out that there were different bacteria that we were dealing with that had to be addressed by different antibiotics. So the fallacy is that one antibiotic will treat, one broad spectrum antibiotic will treat an abscess. That's not true because of the bacteria involved. There are bacteria that are what we call gram-positive and gram-negative, and they have to be treated with specific antibiotics.
And also longer than just 10 days, we found. The pigs that have had the abscesses typically need a month on the antibiotics at least. So,
Is it age-related at all?
It can be. I haven't found I haven't found a specific pattern to increased abscesses in aging, except for the teeth, and that's because they're so old. But as far as like the facial or the surface abscesses, no. Usually what they do is they get an injury, and it could be that another pig has slashed them. It could be that they've scratched themselves on a fence and gotten a boo-boo. And the problem with all those surface wounds is a pig's skin will heal over and the tissue has not healed. The bacteria's in there, it's multiplying, the skin is grown over, and now you have a breeding ground for bacteria and it causes infection. So the best thing to do with any wound is keep it open and let it heal from the tissue side out. When I go out, and I will go out and drain a surface abscess if it's a minor one, what I do is I will cut it open and drain it and flush it out and pack it and let it heal from the tissue side out. I actually will remove a circle of skin. I pack it with sterile cotton dipped in Neosporin, slathered with Neosporin or some kind of antibiotic ointment.
So do you change that dressing like every day?
No, because the pig won't let you. So that's just the initial, and then you treat with oral antibiotics. Because the reality is most people will not be able to change packing in a pig.
So once you pack it,
Right.
you
Once it
leave
falls
that-
out, it falls out.
But
That's
what
why
if
we
what
take
if it
a-
heals over?
You
No,
have to
that's
do
why I
this
take a
yeah.
circle of skin off of it so it can't possibly heal over
Okay.
before the tissue heals.
And-
So it literally is healing from the tissue side out.
And one of the things UC Davis is doing, and they get a tremendous amount of abscesses, and Hampton, the one she talked to about that had the compromised jaw, he's also now continues abscess. His jaw actually broke from the abscess. And that's how Donna realized he wasn't eating. He couldn't open his mouth. It wasn't in a lot of pain. It wasn't obvious. They went in, they removed part of the test, realized they didn't get it all, went back in, removed the rest of it. Now the infection has continued to where the point is the house stinks so bad. He's an indoor pig. The house smells so bad now. The infection's just getting worse that it's going to go into his jaw. And
It probably is in his jaw
yeah, I mean,
already.
it's going to go into his joint, is what they said. But one of the things, real quick, David, is what Davis did is they actually cut because it came to a surface head. His abscess went all the way through inside the mouth and out of the mouth. They've actually cut a square in his cheek so that it's a cross, packed it with BBs, antibiotic BBs, and then sewed it on the edges, so just enough to keep the BBs in. And then they leave it open, and then she has to make sure it stays open. But that's what yes.
Or you can put a drain in a specific area. But
Right.
there are alternative antibiotics that treat a more specific area. Amoxicillin and clindamycin in particular is great for abscesses in the mouth and the face. And then
Either orally or by injection?
either or.
I mean,
Yeah.
you try and inject. We had to give Chuckles injections in January for off and on for 3 or 4 weeks, and at the beginning when he wasn't feeling good, that was easy.